Institute of Mental Health. My name is Tom Pansella with MIMH. Thanks for taking the time to join this program today, which is actually sponsored by the Missouri Department of Mental Health. I'll introduce our presenter to you in just a moment. Before I do, for those of you who have been with us on these presentations before, the screen's going to look a little bit different to you this time. We're still doing the captioning like we've been doing for about the past 6 months on these programs, but now you'll see that it's in a window underneath the video screen. Below that now is the chat window for you to provide any questions or other comments to us. We'll ask your questions at the end of the presentation time, but please feel free to submit them at any time. We'll also send Ms. Broderick's slides to you in a follow-up email, so you'll have access to those as well. If you're watching with a group and you're interested in seeing the captions full screen or at least half screen and the video at least half screen, you can do that by clicking the little link right on top of that caption window, the caption button. And if you right-click it, you can pull it up in a new window, put it alongside, and then adjust your sizes accordingly so that you can see both at the same time if you're interested. As always, CEUs are available for the program. That link's under the video down at the bottom of the page as well. And so I'd like to introduce to you Ms. Francie Broderick, and she is a mental health professional with 40 years experience in community mental health, 37 of which were at Places for People. Places for People served individuals with complex and co-occurring behavioral health disorders, accepting a special responsibility to serve those most in need with the most challenging problems. Safe, affordable, permanent housing became an important focus of the agency's work, and Ms. Broderick initiated the development of several different models of supported housing for the clients of Places for People. In the last year prior to her retirement from Places for People, she created the Missouri Housing Toolkit, and that provides an overview of the issues related to development of supported housing, lists resources available, and gives examples of models in operation here in Missouri. She's currently working part-time as a consultant in the field of supported housing. And Francie, the floor is yours. Welcome.
Thank you. And thanks to those of you who are watching today, because I know how overwhelmed you all are with the work you have to do. But you'll hear today, I think, that I think housing is critical to people's recovery. And I just want to take a moment to tell you why it's important to me personally. This building where we're doing the taping today is where I started my life as a mental health worker in 1972, working for the state of Missouri. My job was to move people out of the state hospital, and they were moved primarily into boarding homes and nursing homes. And in fact, it wasn't a very good situation at that time. I had a caseload of over 1,000 people. I was fortunate enough to be here when a charismatic psychiatrist named Hillary Sandel went out and rented an apartment and took some people from a ward and said, how would you like to live here? And that's how Places for People got started. And so housing has always been a big part of what we did at Places for People. But the sad part for me is over the years, of course, as all of you who are in the field know, we've seen an increase in the number of people with serious mental illness who are homeless. And just in the past year, I had an opportunity to visit a couple board and care homes here in the St. Louis area. And folks, it could have been 40 years ago. It felt like things hadn't changed enough. We haven't, in my opinion, invested enough energy or resources or time or attention into the kind of housing that people need. So, having said that, let's get started. And I have a presentation. The first thing I want to say is, if you look at the first slide, there's a reason I have all those little different kinds of houses there. Not just to be cute, but because the first thing I want to say is there is no such thing as one size fits all in developing supported housing. And that's a theme you're going to hear a lot. You really need to know for whom you're developing and why and what their needs are going to be. So we want to start with some key concepts because, again, before we start talking about developing housing, there's some really important ideas I think that you need to be comfortable in talking about. And if you work within an organization, that organization needs to have had conversations about these topics and see where they're at with these concepts. So the first one is, what is permanent supported housing? The Corporation for Supported Housing is kind of the leader in the field of developing these kinds of housing and tools and resources. And their definition, as you see here, is a cost-effective combination of permanent, affordable housing with services that help people live stable, productive lives. And I think that's a pretty generally accepted definition of supported housing. So what does that really mean and what does that really look like? And who needs supported housing? Well, we know that the people who do best in supported housing are those who are the most vulnerable, those people who have in the past not done well in just being placed in independent community housing with maybe services or maybe not as much services as they need. So it's subgroups of people who have special needs, chronically homeless. They may be in early stages of recovery from their mental illness or their addiction. They may be leaving long-term institutional care, whether a nursing home, a boarding home, or a state psychiatric hospital. Often young adults who are leaving treatment systems or foster care, who've never had an opportunity to kind of live in normalized community settings and are maybe developmentally a little bit delayed just by reason of the life that they've led in institutional care. And of course the other thing we've seen is that high users of emergency rooms, hospital emergency rooms, often there's a housing component that's causing them to be high users of ER. So these are all people who have done really well and been really successful when placed in supported housing, or when able to access supported housing. Excuse my language there. So what does supported housing look like? Well, as I said before, there is no one size fits all. So the key ingredients, of course, are the fact that it's affordable and that there are services and that it's tailored to the population that you're serving. So that could be an individual single-family home or apartment, as many of you who work in Missouri are able to access vouchers for people, and then you bring the services to them in their home. It could be what we call, scattered site, again, a number of different locations around the city. It could be a multi-family building. Let's say you have a building with 100 apartments in it, and the developer has agreed to set aside 25 of those units for clients that you serve. It could be clustered. It could be 2 or 3 apartment buildings within a same block so that you can use staff more effectively, covering a number of different locations. Or in some cases it may be a step down. One may be more highly staffed and then people move to a building with less staff. Or it could be one building, all of the units in the building, say 18 units of apartments, and all of them are for folks with disabilities, and there's on-site services. So again, I'm going to talk a little bit more about what kind of models work better with people with different needs. So again, key ingredients of supported housing. The first again, commonly accepted standard is that housing and utilities combined should be no more than 30% of the individual's income. That's really important. It's permanent. It's not transitional. There's no arbitrary length of stay, and it's independent. The tenant holds the lease in their own name. I want to say a little bit about that concept of transitional. I am fully aware that there are times when there might be a transitional setting. For example, you have people that are homeless and at risk on the street. You may want to set up a building where they can go temporarily until you can compile all the things you're going to need to get them housed. Because those of you who are homeless service providers, many times people come to you, they have no ID, they have no income, they certainly don't have their birth certificate. So it takes a while to compile all of those things. So it may be good to have a place where they can stay temporarily while you work on putting all that together. But what I'm talking about is the notion of you come here and you stay 6 months and then you're all better and you move on to complete independence. That notion of transitional hasn't worked so well for some people because there's no way to predict how long it's going to take for somebody to really be able to live on their own or move on to another setting. And also a lot of times if people are doing well in one setting, they don't want to leave. It's become their home. So when we're talking about supported housing, we're generally talking about housing that's permanent and that they have a lease. Here's another thing that may be a little different, that services are individualized, flexible, voluntary, and targeted to the specific needs of the residents or the tenants of that project. Voluntary is a key word there. Let me go back to that. It is a key word there. Often in the past, participation in treatment plans or taking medication have been a requisite staying in housing, and that hasn't always worked so well for some people, and in fact it may not even be an appropriate thing to do for adult people who have a lease in their own name. But what that means then is that it's incumbent upon the provider to make those services such that the person feels that they're useful to them. And what we have found and what the research shows is that even though the services are voluntary, most people in supported housing will access those services if those services are relevant. So again, it's a little more of a challenge for the provider, but the other thing is what we're trying to do is help people with the greatest need. And sometimes the people with the greatest need are not going to respond well to what they feel is control or mandatory or coerced treatment. So services being voluntary is a real important part, and that might be something you want to discuss a little bit at some point later on. Permanent supported housing is cost effective. It reduces the cost of emergency room and hospital visits, reduces days in shelters and jails, and it improves the health outcomes. 80% of tenants maintain their housing for 12 months or more. And the other thing that's been found over and over and over is that any combination of housing and services produces better outcomes than either one alone. And the Corporation for Supported Housing website has some really good data that will give you the specifics on this if you're interested in looking at that, or if you need some supporting documentation for a grant you're writing or an application or to convince your boss or your board. I would really encourage you to look at their website. Another important concept that some of you may be familiar with, I hope, is called Housing First. Housing First is now considered a best practice. The Missouri Housing Development Commission, which is a key funder for low-income housing development, has adopted Housing First as a criteria for evaluating applications for funding that come in. So it's really important that you understand and are comfortable in talking about the concept of Housing First. Because if you apply to MHDC, the Housing Development Commission, for funding, they're going to be looking for Housing First language in your grant application. And what that means simply is that the first thing you do with the vulnerable people is get them housed. And then at the same time, concurrently, you're working on whatever the issues are that they need to work towards in recovery. And I think that sometimes that's been a hard concept for some providers who are new to it. Because what it means is that we don't require that you be clean for 3 months. We don't require that you be stable and on medication for 6 months. We don't require that you sit through 6 weeks of life skills training classes before we put you in an apartment. For some people, that just doesn't work. For some people, that makes the threshold for accessing housing and services so high they drop out. So if what you want to do is reach the people in most need, the most fragile, the most vulnerable, the Housing First model has found to be the most effective. But I will also tell you, it's not always without challenges. Because it means that people are in early stages of recovery often. They may not be taking medication. So you need to really think through what that means for your agency and how you'll respond when things get a little bit interesting. But again, you think about this for yourself. If you're hearing voices and you're ill and you're living on the street and you have no place to sleep at night, where do you think you're going to have a better chance of dealing with your addiction or your mental illness? Living on the shelter, or living in a shelter or at a bus stop, or when you're safely housed? And that's been, again, the experience of many providers who use a Housing First model. Another website, and this will be up there somewhere, I think later on, but I would encourage you to write this one down. I love this organization. It's DESC.org. It stands for Downtown Emergency Services Center, and it's in Seattle. And they've done a lot of work with a Housing First concept and also harm reduction. They place people who are, quote, chronic inebriates, who have no intention of stopping drinking, who have been living on the streets, who have incredible health risks, who die on the streets, and they've had amazing success in helping them have their lives be better. And I'm so impressed with their work. I'd really encourage you, if you really want to understand more about how Housing First works, check out that website. The last concept I want to talk about before I go into more of the development process is an array of choices. When I first started in this institution, we talked more about a continuum of care. And the idea was that people moved through a continuum of levels of housing. So you started with the most restrictive, which was the hospital, and you moved through different stages to the least restrictive, perhaps your own apartment. So we had all these different concepts on paper of, group home 3, group home 2, group home 1, residential care facility, semi-independent apartments, clustered apartments, and then finally the holy grail, your own apartment. Well, it didn't work so well for some people. One thing that happened was that some people got stuck at the higher levels of institutional care. Another problem happened. The other thing is that it's based on a model of mental illness being linear, as if people just get better and better and better and better. And so they move through this system to more and more independence. Well, most of us know that it's not always that path for some people. There's ups and downs. And so you don't want to have to constantly be moving people from one setting to another when they're needing more services or more help. And then the biggest problem with that continuum of care model was, frankly, it didn't pay a bit of attention to where people wanted to live. It didn't pay any attention to individual consumer choice. And so if people came and they were assessed and the professionals said, well, we think you need to start at this level of care, at an RCF or a group home or whatever, and the person said, no, I want my own apartment, the answer, unfortunately, was usually, well, then I'm sorry, if you don't take our choice, we can't help you. That's when the continuum was implemented rigidly. Well, we've moved away from that. We've moved away from that kind of, and we've had much more of a focus on client choice and understanding where people want to live and how we help them live in the way that will make them most happy. But does that mean I don't believe there's a need for congregate settings or for specialized housing? Not at all. Not at all. As I said before, there is no such thing as one size fits all. All I'm saying is that instead of a model of a continuum through which people have to move through, you see, put the person in the middle, and then they're surrounded by an array of choices. And based on the conversation, or sometimes the negotiation, that you and the individual have, you try to pick out what's the best option for you. Is it an individual apartment where we bring services to you? Is it a group home for a while? Is it a supported housing project where you have your own apartment but there's staff on site? What's, based on your history, based on where you've lived before, what's going to work best for you? So when I say an array of choices, that's simply what I'm talking about, that it really is a choice. But to have an array of choices, sometimes we have to develop those choices and those options. Okay, we've gone through the issue, so where do I start? Well, the first thing is you have to know what's the problem you're trying to fix. And let me just tell you, and I don't want to offend anybody who has started this way, but I've seen people who start with saying, I have a building, or I have a piece of land. And I would say that's one of the last places where you start. The first place you have to start is identifying what's the problem. Who is it that needs housing and why? Is it just because there's not affordable housing? Is that the biggest issue you have? Is that there's not enough affordable housing in your municipality? Well, that would suggest one course of action, perhaps. Or is the issue that there's not enough of the right kind of housing that people might need? You have specialized populations of people who might need on-site services or a little more of a secure setting. So is that the issue? Or are there people who haven't been able to access housing because they have a history of because they have a history with the criminal justice system, or they're on the sex offender registry, or they have a history of fire setting, or whatever those issues might be. What is the issue you're trying to fix? You really got to figure that out first, because everything else is going to flow from that. So, yes, answering the question about what's the problem you're trying to fix, your case statement and supporting data will come from that. So, in other words, if I go to a funder and say, I want to develop some housing, I need to be able to say, why? Why is the housing that's available in this city, the vacant housing or the rental housing, why is that not sufficient for the people I serve? Is it because, again, there's not enough on-site services available, or what exactly is why? Who is the population of people who aren't being successful in keeping their housing? And bring the data. Show them the people you have who are on waiting lists for housing, who have been evicted, who are living in boarding homes where they don't want to be and could be somewhere else if that were available. Show them the people that are homeless that you're serving. Show them how many people are using shelters in your system. Bring that data. Your building design and location are also going to be dependent. We'll talk about this a little bit in another slide on who you're trying to serve. If you're serving frail elderly coming out of institutions, that might suggest one thing about a neighborhood where you could build a building. If you're serving people in active early stages of recovery from addiction or mental illness, who are still using crack or drinking or not taking medication, that's a whole nother kind of neighborhood you're going to be looking for. And I've done that. I know what that's like. And it's worked. It's been successful, actually. We found a neighborhood who wanted us. So who you're serving is going to impact on where you put the building. It's also going to impact on the design of the building. Because if you're serving people who have problems with judgment, who have security issues created by their drug use, for example, you're going to want a building that's designed around those issues, maybe with a secure front entrance or just one entrance, not everybody having their own entrance. So you have to answer that question. And then again, your service, your staffing, and your funding are all going to be determined by who you're serving. So that first question is, who do you need to serve and why? Not, I got a building. Okay? So ways to find those answers. Well, obviously, you look at your data and you look at your outcome, and you ask your clients. You look at your data. Where are most people living now? How many people are homeless on any given day? How many people have been evicted or asked to move repeatedly? And what's the common denominator among those folks? I remember one time we started looking. We did have an emergency building. It was just a 10-unit apartment building, and it was for people coming right in off the streets. Again, who needed that time period to get their resources together before we could start looking for permanent housing. And for people with a history of serious mental illness, they did real well in that setting, actually. We could get them hooked up with medication, we could see them daily, and after we got all their paperwork together and got vouchers and ID and all that stuff, we were able to move them into permanent housing. But there was a subset of people who just were causing chaos and bouncing out and not making it in that temporary housing setting. And when we looked at it, the profile was of young women, many who had been in foster care, who were custodial parents, who had one or two small children with them, and who had a history of getting involved in abusive relationships. This is probably familiar to some of you out there, I'm sure. So for the people whose illness we could address with medication, they did well in that setting. But for these young women who had chaotic lives, who had been traumatized, who had issues with partners who were abusive, they just were not making it. So we started looking at, okay, well, what would be a setting where we could put those folks or help those people live safely while we try to get them into permanent housing. So examine the data. Look at who's getting evicted. Look who's constantly being asked to move. Look at your high users of emergency rooms and your on-call, and look and see, does housing have anything to do with that? And then finally ask your folks, ask your clients, the family members, your clinicians, where is it that people are living and where would they like to live differently or where would they feel better? How many people do you have living in residential care facilities who maybe could live someplace else if that someplace else were available? And now, I don't know if you can see this slide. Probably shouldn't make slides so little, I've been told a few times about that. But it's that concept I want you to think about, is that you start with this broad group. Okay, we have a lot of people with mental illness who need a change in their housing, either because they're homeless, they've been institutionalized, they're aging out of juvenile services, or they have frequent evictions. So do they all go one direction? No, probably not. So you might break that down into saying, well, we have a group of those folks who are now in active recovery and treatment. They're engaged in treatment. They're taking medication. They're relatively stable. And all they really need is access to affordable housing or a voucher. And then they can live in that what we call generic community housing that you and I would rent, anybody would rent from a private landlord. And they can have their visits brought to them from their off-site workers or whatever system that you've developed. But that's one group of people. And for that group of people, what that suggests is you need to be working, for example, with your local public housing authority to find housing vouchers, or working with your city to see how do we subsidize affordable housing for folks. That's one. But then within that larger group, there's another subset of people who have a need for significant support, either because they've been really institutionalized a long time, they're in early stages of recovery, they're still very volatile, their lives are still very chaotic, they may need something different. And so even within that group, then, you may want to break that down into more subsets. There's those people who are able to accept assistance with the medication, the ADLs, get the support, and they might do well, say, in a set-aside where you've got a large apartment building and you've got 5 units in that building, and you can bring intensive services to them. Or Chi Chung, a provider here in Missouri, New Horizons, has an arrangement with Public Housing Authority where he has units within a larger building. And so they can bring services to those folks within an apartment building. So there may be ways to get them more intensive services that they need along with the affordable housing. And then there might be another subset of people whose needs are even greater. Their needs for security, for monitoring visitors, and they may need that 24/7 availability of staff. They may need somebody watching that front door, monitoring visitors, seeing who's coming and going. They may need somebody there if they wake up at night and they're feeling paranoid. They need a reality test. So you've got to. I'm just trying to get you to think in terms of a way to break down the different subsets of what kind of housing people need and how you tie the needs of the individual to the kind of housing model you're going to create. Okay, so you know why you need to do it. You know who you're doing it for. So where do I get started? What's next? Well, you really need to. And again, I don't know how many of you are agency directors or in a position to make decisions, but you really need to have some support. You really need support from your organization, because I don't know if I say this further in or not, but when you're developing housing, and I can tell you from my own painful experience, this is a marathon, it's not a sprint. It may take several times for an application to get through. You really need a committed board. And there's a little bit of risk involved, and your board needs to understand what that risk is. So somebody at your organization has got to take responsibility for selling this to the leadership, and maybe you're the leadership, and good, I hope you can do this then. Selling this to the leadership and to the board and saying, if we want our folks to get better, if we want them to have a chance at a good life, we need to do something around housing. We need a housing plan. But again, it needs to be a part of your overall agency mission and probably your strategic plan. And then you need to know who's going to be the lead in your organization. What resources are they going to commit? Are you going to be the lead person? If not you, who? Is it a team? Will your cash flow allow you any money for pre-development? Because there's always some cost before any money starts coming through. There's always cost not just of your time, but before you can even put together an application to submit, often you have to secure land, you have to do surveys, you have to do market studies, you have to get some broad architectural plans. So there's often a cost involved early on. So you really need to take this to your board and see what is your board comfortable with, or whatever your governance system is. Yes, that's what I said. It's a marathon, not a sprint. And I can tell you that one of the projects we are most proud of at Places for People, it took 4 applications and a lot of crying, whining, tantruming to finally get that through. But it's a big project, it's a wonderful project, and you just got to keep at it. So first thing you have to decide, another thing you have to decide, it's not the first, but who's going to be the developer? Maybe some of you out there have been a developer, maybe you've partnered with developers, and as with anything else, there's pros and cons. Now, when I'm talking, right now I'm talking probably a lot about doing a multi-layered financing project, and that's the way most of them are these days. It will be rare, almost impossible, I hate to say it, but almost impossible that you will find one place where you can go and get all the funds you need to build or buy and rehab a building. So we're talking about putting together many layers of funding. Excuse me. So you can do this, you can be the developer, the one that pulls all that together yourself, or you can work with somebody else. So what are the advantages of being the developer yourself? Well, first of all, you have more control and flexibility, obviously, over design and the future use of the building. you're building assets for your agency. Because even if you partner with somebody in a long-term project, tax credit project, for example, when the time frame for that project period is up, the building converts to your agency, you're the owner of it. As a nonprofit, you're able to apply for grants to help cover the gap funding. In other words, let's say you've got tax credits, you've got other federal home funds, and you've got a gap of $200,000. As a non-for-profit, you can apply for grants that perhaps a for-profit couldn't apply for, wouldn't be eligible to apply for as the developer. The biggest thing is that you have control over tenant selection. You can choose to serve those most in need with the most complex issues. And if you're working with a for-profit developer who wants to serve people with disabilities, that's great. But if they're also going to have to market those units to other people within a larger building, they're going to be less excited about serving some of those people who have the most need. And you know what I'm talking about. I'm talking about the people who can't sleep at night and they're walking the halls, maybe knocking on doors, asking for cigarettes, people who are anxious and pace, people who bring in people who are maybe looking a little bit unsavory. A private for-profit developer, understandably enough, is probably going to be a little bit nervous about that kind of tenant selection. But again, if you're going to serve those most in need, those may be the very people you want to help house. So if you're the developer yourself, you have much more control and flexibility in those areas. And the other thing I didn't mention, but it's not insignificant, if you work with a project like a tax credit project, you get to charge a developer's fee. And that fee can be significant. It's based on a percentage of the cost of the total project. And that fee you can use maybe to hire some consultants to help you. And what's left over, you can put back into operations, into helping support the project into the future. And that can be a considerable amount of money that can really help support the project. So that's, again, another reason for you to think about becoming the developer yourself. Now, reasons not to be the developer. Well, lack of experience, lack of time or staff, financial risk. I'm sure you've heard all these before. Potential conflict between being a service provider and an owner, or just simply ideology. I know there's some agencies have said that their board says, no, we're not going to own property, we want somebody else to do it. I think you really need to look hard at that, because how long have we been here since deinstitutionalization? Let's see, the 60s? Who's that somebody else who's going to do it, folks? I haven't seen too much somebody else's out there developing for the hardest to place people. So if your board says, we have a position we don't want to own property, then ask, who is? And maybe they want to set up a subsidiary, a nonprofit subsidiary that will develop property and develop housing. Fine, but the question is, if not us, who? Okay, more development options. Well, okay, back to that question of, well, I've never done it before, I don't have the time, I don't have the experience. That was me a few years ago, specifically for a tax credit project. My agency had never done a tax credit project. Many mental health providers, not many of us ever had. So I said, I don't know a thing about this. I don't even know what I do with tax credits. I'm a nonprofit. What do I do with tax credits? So what I want to tell you, though, is there are consultants out there who will hold your hand and walk you through it, and there are some very good ones. And I can't give you the names because I'd probably tell you the name of mine, who I think is very good, but the Department of Mental Health Housing Unit will give you the names of good developers or good consultants who have been through the tax credit project or compiling property, parcels of land, and know how to do it, and they can walk you through it. And if you're the developer and you want to hire a consultant to work with you, that developer's fee that you get for being the developer, again, a part of that you can use to pay the cost of the consultant. And you can then still be the owner and have all those advantages we talked about of being the owner yourself. You can also partner with a private developer. You can find a nonprofit that shares your mission. Maybe it's a community action agency. Maybe it's a specific nonprofit or affordable housing agency that's there to develop housing. and they say, yes, we'll develop a housing project and we'll manage it, and you can do the services, you can do the client selection, you can do all of that, and we'll partner with you. So there's a number of options, but again, you need to figure out which one's going to work best for your agency. The other thing I mentioned a little bit before, but be ready for those upfront costs. There is a cost before you can put in an application for any of the major kinds of funding streams that you're going to want to apply for. And these are some examples of some of the things that you might have to pay for. And it could be anywhere from $30,000 to $60,000 or more or less even of that you're going to need for upfront money. And that money is at risk, by which I mean if your project doesn't get funded, nobody gives that money back to you. You've got the surveys, maybe you've bought the land, maybe you've paid for some architectural fees. But on the other hand, I said this is a marathon, not a sprint. So the first time I applied for a tax credit project for one site, I had all that together and I had spent the money and I didn't get funded. But most of that I was able to compile and reuse with very little additional cost for the next time I applied. I had to update the market study and a couple things, but again, the bulk of the money that I had spent didn't go to waste because I just kept applying again until we got it funded. So, but again, that's something you need to be thinking about is where am I going to get the money for my upfront cost? And if you look at a variety of the housing toolkit, the DMH housing toolkit that is online at the DMH website, it suggests a few places where you can go for pre-development money. And I would encourage you to look at that if you're interested in doing this. The building. Okay, then you have to make decisions obviously about the building. And one of the first things is, do I build new or do I renovate? So these days it's often cheaper to build new than to renovate, especially if you're doing a historic renovation, because of all the requirements around accessibility. And then you also may want to have a specific design. Again, we talked about maybe you want a single entrance, a single front door so you can control access and monitor it a little bit based on who you're serving. So it may be harder to find a building that's already going to lend itself to the kind of design you want. So that's one of the first decisions that you're going to have to make. It used to be that historic tax credits were a little bit easier to get, and you could combine that with low-income housing tax credits. There are a lot of historic buildings in the larger urban areas of St. Louis, but honestly, it's a little harder to get funding for a combined historic and low-income housing tax credit project these days. So you'll probably find that that's why some organizations have chosen to build new instead of renovating. Obviously, if you're working with a consultant, you need to find a consultant, and I don't know if there's any outstate consultants here, but I really recommend you get a consultant who knows your city or your municipality, because they need to know the politics, they need to know the neighborhood, they need to know occupancy, zoning, just all kinds of things, and it's going to be different in each community. So if they're not from your particular municipality, they need to be pretty clever, or you need to have people in your area who can fill them in on what the political issues are that they're going to have to work with. And then, of course, you need to know the neighborhood. And again, that's going to be determined a lot by who you're serving and what's the best fit for that neighborhood. One thing that we found, and I worked with some really good consultants in the city of St. Louis, when we approached neighborhood organizations, of course, first in the city you approach the alderman, then you approach the neighborhood organization. And instead of going in with a particular site that we had in mind, often we said to them, what's an area you'd like to see developed? What's a corner lot? What's some buildings that are problem buildings for you? What's an area you'd like to see developed? And oftentimes we got a lot better acceptance by using that approach than going in and saying, we're building on this corner here. Design considerations. Again, these pictures up here, this is a building that was designed specifically for people with history of serious mental illness, homelessness, frequent evictions, about half of whom are HIV positive. They have a long history of addiction in addition to their mental illness. So what that meant is that a lot of times they had issues with visitors, with people who might want to buy or sell drugs on site, which was not not part of the policy. So we needed some kind of on-site control and monitoring. So you will see that this building was designed to have a single entrance, and there was a desk in the very front in the center of the building, and the person who was always there 24/7 at that front desk could look out the back window, out the front window, look, as you can see on that one little picture, look up the halls on the second floor and on the first floor. And that's because that building was designed with more of a security issue in mind. Another project, may not need that level of security, even if you have on-site staff. But again, you need to really think about who are you serving and what are going to be their needs. How much congregate space are you going to need? Do you want congregate space? Do you need program space? I'll tell you a project that I just thought was wonderful. I love this concept. Some of you may not appreciate it, but I loved it. It's a program in Minnesota that is very culturally relevant. It serves Native Americans. And again, it was all folks who are what they called chronic inebriates, which means they've been drinking a long time and didn't necessarily think they wanted to stop. So that project was designed with hallways very narrow, so that when the guys came in and they were stumbling, they would fall against the wall and not on the floor. Now, I know some of you may think, oh my God, what are we talking about here? The point is, what do you want to do? You want people to be successful and you want people to get better. So you design the housing around what their issues are and what their needs are. And the other thing that you might want to do is talk to your potential tenants and ask them what do they think should be in a building. What would they like to see? But you really have to give this some thought. One of our seasoned staff was talking about some young men at one point, and she said they need a building where there's a locked front door and no congregate space, because as soon as they get in congregate space, they get in fights. So again, you really need to think about that. I've seen other projects where they're serving young adults, and there's a computer lab, because these are folks that are still in school, they're trying to get back into work, so there's a room that's like a study room, and there's a small room that's an exercise room or a gym. So again, it has to go back to who you're serving and what their needs are going to be. And then your housing philosophy. This is something you need to, if you haven't talked about it, if it's not in the guts of your organization, if you don't know what it is, you need to have a conversation about how much risk you're comfortable with. Does your agency have a housing first philosophy? What kind of array of options do you want to have in terms? Maybe your agency isn't going to be one that wants to take on people in early stages of recovery from addiction. Maybe it's just not something that they want to be involved in. But again, I say, if you're serving those folks, then where do you want them to live? And that's a question that I think as providers we have a responsibility to answer if we want to serve people when they're at their sickest. It's not enough to say, but that's too risky. Who's going to do it? Okay, get off that soapbox for now. How does philosophy impact management and management impact philosophy? And this is why I was saying you need some ideas about where you stand. Obviously, it's going to make a difference in who you choose to live there. Are you going to have guidelines about how long people have to be drug-free or not? What about evictions? What about when people stay away overnight for several days? What's going to be your policy around that? What about on-site use of drugs or alcohol? If alcohol is legal and these are adults and it's their home, they actually have the right to use alcohol. But what if you say, but this is a program where people are trying to get into sobriety or get into active treatment or relapse prevention? We don't want. So do you say, well, the policy is you can use in your room but not in the congregate areas? Or what's going to be your policy about that? What's going to be your policy about visitors? Are people allowed visitors? Well, they probably need to have visitors if it's their own apartment, but what are the limits you can put on visitors? What about access? Can people stay overnight? What about kids? Can kids come in? And then this last one, re-traumatizing residents. That when I first started doing housing, we didn't really talk about trauma so much. Now I know you're all talking about it quite a bit, at least I really hope you are. It's almost a given that most of the people that we serve have experienced trauma, probably multiple times. And so when you're designing your building and your management philosophy and policies, you need to be thinking about that. And I think one of the things that can be the biggest trigger for trauma is that sense of powerlessness, that somebody else is in control and I can't have control over my life. So Do you have policies, for example, that say you have to be in your room all night long and you can't come out and walk the hall? Well, some people who've been sexually abused, nighttime was when it happened. And they don't sleep at night, and they don't get under the covers, and they don't change into night clothes. They lie on their bed with their clothes on, and maybe they even want the door open. So what are your policies around those things? How much flexibility are you prepared to have? So these are just examples of things that I would suggest that you want to think about and talk about with your clinical staff before you start thinking about, I want to develop a building. And then putting the financing together. As I said before, there's not one source that's going to cover everything. So you have to be creative. So there's three things. We always talk about three legs to the stool. And that's the capital, money for capital. That's your bricks and mortar, the building, whether it's buying or renovating or building, whatever it is, it's the building. And the second leg is going to be the operating, what helps pay the rent and keep it up over the years. And the third is going to be services. So the first leg of the stool. Here's where it gets a little bit tricky. So you may want to come back and look at this later, or there's a lot of websites you can use. HUD 811 is a program that many of you may be familiar with. It's the federal program that has been most used in Missouri to develop affordable housing for people with disabilities. And when I visited a lot of the providers around the state, a lot of you had used HUD 811 funding. And the beauty of the HUD 811 funding, it did pay for a good percentage of the overall cost, and the really good thing about it is a subsidy came along with it. So not only did you have the money to build, but each month for every unit, the rent was subsidized. And we call that, and I will refer to that the rest of this presentation, as PRAC, P-R-A-C, Project Rental Assistance Contract. That's essentially the subsidy that comes with every unit in a HUD 811 building. Another option for funding is MHDC. MHDC is the Missouri Housing Development Commission. That's going to become more and more important to providers like us because the HUD 811 essentially is disappearing. I'll talk about that again in a minute. So MHDC is going to be the holder of most public funds for developing housing. So if you really want to get into this, you really need to start to get familiar with MHDC. MHDC has a program, LIHTC, Low Income Housing Tax Credit Program. They handle home funds, which are, again, federal funds that might be something else that you can get to help complete a project. They're just direct funds, like a grant fund that comes to you to help with your project. They have a trust fund, which is an annual fund that you can use. You can apply every year, and you can get some money to help fill the gaps in your capital project. Historic tax credits, or the other thing that you can do is you can partner with developers for the set-asides. You can do a master lease. In other words, you find a landlord who's got a building, and that landlord says, I'll lease the whole building to you. You sublease to individual tenants. There's public housing, or you can just simply buy. This is a good time to look for foreclosures, I'm sorry to say. Your agency may want to commit to buying an 8-unit building for people. There's all these various options that you could be pursuing to get that first leg, the capital. The HUD 811, this was a building that was done in the 70s with the HUD, actually it was 202 at the time, but it was same program. 202 spun off into 811, but this is the stream that was mostly used at one time, and that has changed now. There was something called the Frank Melville Supported Housing Act that has totally restructured the HUD 811 program. And one of the biggest reasons for doing that is some of you are familiar with the Olmstead Act. This was a Supreme Court decision that says it raises the bar around kind of the ADA, the Americans with Disabilities Act. No longer do we just say that people need to live in the least restrictive setting. It says people need to live in the most integrated setting. So the concern among some advocates was that by using the HUD 811 project, we were creating, quote, mental health ghettos or disability ghettos. We were creating housing where everybody in the housing had a disability. So the HUD 811 program has been drastically changed to address that. And the Melville legislation, again, this is stuff that gets a little detailed, but this will all be on the web. It's in the housing toolkit. The Melville legislation has now been designed to be used in combination with other funding, like the tax credit program. And what it will supply now is not so much the capital, although that may come down the road later, but it will supply that PRAC, the housing subsidy, to help pay for the rents. But the key is no more than 25% of the units in a building can be set aside for people with disabilities. So this really changes the whole scene quite a bit. Now, what HUD says is there'll still be the opportunity to apply for the traditional 811s, but nobody really thinks that's going to happen, and there's no money in the budget for the next year for that. So you really need to be thinking about looking for other sources other than the 811. So right now, this new Melville HUD 811 has been put out there as a demonstration project. The states can apply to get some of this PRAC money, the rental money, to be used in combination with tax credit projects. Missouri has applied. They haven't heard yet if they're going to get it. So all of that is still very much up in the air. What you need to learn more about is the low-income housing tax credit program. Again, some of you are saying, I'm a nonprofit provider. What do I need with tax credits? The way that program works is you partner with an equity provider. You partner with somebody who buys those tax credits from you. There's two kinds of credits. There's 9% and there's 4%. The 9% means they pay 9% of the cost of the project, of the allowable cost, 9% a year over 10 years. So obviously people want those 9% credits. That round for the 9% credits is usually in the fall, and they're very competitive because they pay for the bulk of your expenses. The 4% credits, that round is usually in the spring, and they're less competitive because you have a much bigger gap to fill. But I would encourage you, if you really want to get into development, to meet with somebody, meet with a consultant, meet with me, and learn about how that tax credit program works. It's very doable, and it's how most of the affordable housing in this country has been created over the years. I'm going to kind of go through this kind of quickly. I know I'm running a little short on time here, but what I wanted to say is that before 2010, mental health providers did not use this program, the low-income housing tax credit program, much because we couldn't compete with the large developers. As a result of some advocacy by a number of people, MHDC now does a set-aside for special needs within their tax credit program, which gives you more of an advantage. It was State Treasurer Clint Zweifel who championed that. Initially, he got 2 set-asides for special needs projects, and last year the goal was 1/3 of all credits. So it's really made it easier for providers to get a leg up. The other thing it is important for you to know is that a project doesn't have to have all the units be devoted to special needs to be considered a special needs project. So let's say ABC for-profit developer wants to do 100 units. They can approach you and say, I'll give you 25% of the units in this building if you partner with me. And then that developer gets to be counted in the special needs set-aside. So there's a real incentive for developers to partner with you. So if you don't want to be the developer yourself just yet, at least you could be looking for some developers in your region who may be doing some projects who want to get that advantage of having a special needs partner. MHDC also has, again, the home funds, the Housing Trust Fund, and HAP credits, which is like the Neighborhood Assistance Program credits, and that if somebody donates to your project, they get a partial tax credit for it. Historic tax credits are still out there. It's gotten harder to partner those with the low-income housing tax credit, but they still are out there and they're still available. Again, Master Lease, I'm going to go through these I want to get to this one. This is real important. I think a lot of people don't think about this. Even if you have no debt on a building, let's say you build this building, you've got no debt on it, and so you want to keep the rents as low as possible, it's still going to cost you probably about $400 a month just to cover your utilities, insurance, security, reserve for replacement. So if your clients are mostly on SSI, it's not going to cover the cost of this apartment. So you need operating subsidies. And these are just some examples of the kinds of places you can get them. And most of these you should probably be familiar with if you're in Missouri. We've got Affordable Housing Trust Fund, Shelter Plus Care, grants, supportive community living, working with local public housing authorities or to see if they can apply for special needs vouchers. But that's something you really need to think about. That's an important thing that people often forget about is how am I going to keep this going over the years? And the last thing is what you're all the best at is the services. And one of the wonderful things that's happened in the past couple of years is that the Department of Mental Health has created a new Medicaid-funded residential rate called IRTS, Intensive Residential Treatment Services, I guess. And that's going to be something that can help you pay for those 24/7 on-site services. In the past, you all know you could bill Medicaid or whatever community support through your CPRP program. But for that person who was just there kind of overnight and being available for when things came up, it was much harder to find funding for that. So these new IRTS dollars are going to be available to pay for that. And then again, if you know specifically what population you're serving, there are very specific service dollar grants that are available. And again, if you look at the toolkit, if you're serving veterans, chronically homeless, there's a number of other places where you can go for grants to get those service dollars. So what I'm suggesting is that your agency talks about a housing plan. What are your priorities? What models of housing do you want most? Who are you going to partner with? All these things we've just been talking about. These are some of the resources that I think are really important and could be really helpful for you. If you go to the DMH Housing, go to the Missouri Department of Mental Health website, they've got a housing unit. There's all kinds of great resources. I've tried to just sort of skim everything, give you an overview, give you some concepts to think about, and tell you, you need to do this because we have people in unacceptable situations on the streets, in institutions, and that's no way to live. So I hope I hear from some of you. If you have questions, I'd love to answer them. Tom?
Breathe.
Yeah.
Excellent, excellent. Pause for just a moment to see if any questions come in through the chat. That's just below the caption window on the screen there. In the meantime, if you're interested in purchasing CEUs, below that chat window, there's a link to purchase CEUs. And as I mentioned earlier and in the chat, the PowerPoint presentation will be made available to you in a follow-up email, as well as an avenue to contact Francie directly. She does have a consulting agreement with the Department of Mental Health here in Missouri, and so if there is something that you would like to talk to her about directly, email her with ideas, some questions, some comments, she'll be able to follow up with you in that regard as well. Well, in the meantime, I do not see questions popping into the box. So that gives us the opportunity to say our hour together has been filled very, very well. A lot of wonderful information. I hope you all find this very, very useful. Keep your eye on our website for additional web conferences that are coming up. We've got a lot of them popping onto our calendar in the first half of this year. So we hope you find some topics that are interesting to you. Share our information with your friends, with your colleagues, so that they get onto our email list as well. That's our primary way of reaching out to people. So we hope that we find topics that are interesting to you and that are useful to you. So again, thank you for your time, folks. And Francie, thank you for your time today.
Thanks. It was fun.